Hello everyone, I'm Dr. DEVJANI GHOSH SHRESTHA. I'm a consultant ENT and head neck cancer surgeon based in Kolkata. Today I will be speaking to you about childhood deafness or congenital hearing loss. Childhood deafness is a very common phenomena. 1 in every 1,000 children are born deaf or have impaired hearing. It is defined as hearing loss in both ears, which is permanent and which is above 40 decibels. In about 60% patients, the children have moderate hearing loss, that is 41 to 60 decibel hearing loss, and in the rest of the patients the hearing loss is severe or profound. That means it is between 60 to 80 decibel or 90 decibel or more respectively. So what are the types of childhood deafness? It may be two types. One is congenital, that is when the child is born with a hearing loss, or it may be acquired, that is the child develops a hearing loss due to some cause after birth. There are a number of causes for childhood deafness. It may take place due to very low birth weight or preterm infants, children who have been exposed to infections like rubella or cytomegalovirus inside the uterus. It may occur when there is hyperbilirubinemia or hypoxia. Whereas in acquired deafness, it may occur if there are infections like meningitis, mumps or measles after birth. The newly diagnosed deaf child is a entity, which means that it is very difficult for the family or the physicians to come to terms that a child is completely deaf or has impaired hearing. Whenever the diagnosis of deafness in a child is made, it is a very difficult reality for the parents to come to terms with. A lot of emotions come into play. There is anger, frustration, depression, inability to deal with the truth, and even loneliness. However, it is really important that the diagnosis is made as early as possible and we treat the child. This is because the language and communication of a child depends entirely on hearing. Our brain is made in such a way that it can detect any auditory or hearing stimulus up to the first decade of our lives. So the critical hearing age of a child is up to 5 years. So only if we intervene within this age, it will be possible for the child to attain a normal hearing and communication skill. Anytime after that, even with the most advanced treatment, it may not be possible to achieve the best results thereafter. The diagnosis depends on a number of factors. In India, still now, universal neonatal hearing screening has not been implemented. So the initial diagnosis happens when the patient's parents or the teachers suspect, and there is a screening during school entry. Once the child is brought to a physician, we do a lot of audiometric tests to diagnose. Thereafter, pediatric evaluation testing of the eye to look for any other congenital abnormalities is done. A CT scan of the temporal bone is also done to see if there are other problems which even guide us to further treatment. In case of a child who has impaired hearing in both ears, the first treatment which is possible is hearing aid. This is the first line of management and probably the mainstay of treatment. So the hearing aid, what it does is it amplifies the sound and it presents to the child. Supplying, fitting, and after that the speech and speech therapy should always be done by an experienced audiologist. Presently, a number of hearing aids like behind the ear hearing aids, bone anchored hearing aids are available in the market. So kids have no problem in adjusting and they can very easily adapt to these hearing aids. The second treatment option is cochlear implants. This has revolutionized the treatment of hearing loss. Cochlear implant is a device which has an electrode array which is inserted surgically inside the inner ear or the cochlea of the child. In this electrode array, what it does is it takes the sound, it modifies it into the signal, and it presents it to the part of the ear by bypassing the damaged part of the ear. Therefore, the child can hear normally again. It also has an outer component which is coupled to the inner part with the help of a magnet. So after the cochlear implant fitting is done, the child needs to undergo speech and language habilitation training. So this is probably the most important part of the training, and the patient's motivation and their patience is extremely important. So the patient has to be taken for regular therapy classes so that the child start understanding how to listen to the sound and how to speak. So in our experience, we have had many such operations in our center, and we've witnessed in centers around us. These children ultimately develop completely normal hearing, and they study in normal schools with their peers. So in conclusion, I would like to say that congenital hearing loss or childhood deafness is something which we should know about, we should be aware, and in case we suspect something like this in our child, that our child is not hearing, we should immediately visit our nearest ENT surgeon or specialist and make